You're listening to Compliance Conversations, your inside scoop on all things healthcare compliance, auditing, and coding. Now, let's get on with the show.
Everybody, to another episode of Compliance Conversations. My name is CJ Wolf with Healthicity, and we've got a great episode for you today. A great guest, Heidi McKinnon. Welcome, Heidi.
Thank you so much for having me. I'm very excited to be here.
Yes, thank you for your time and willingness to share some of your expertise. Heidi, before we kind of jump into our topic, we love to hear from our guests and hear a little bit about them. What brought you to this? You're right. We all come to compliance and regulations in a different way, and we'd love to hear a little bit about your path here, or whatever you want to share about what you're doing now.
Thank you. Yeah, my path is certainly, I would say, different than most people that you might find as a head of compliance. I started off in pharmacy as a retail pharmacist, and but once upon a time, I really wanted to be a law enforcement officer. And so I never quite lost that love of rules and regulations. And so I had an opportunity to apply to the Washington State Board of Pharmacy. And I ended up being a Board of Pharmacy investigator and inspector for Washington State for many years. And it really allowed me an opportunity to deep dive rules and regulations across all facets of pharmacy, and look at it from a new perspective, not just what you're supposed to do as a pharmacist, but how the rules should be interpreted,
Okay.
which is different than, boots on the ground. You don't really think about how I should be interpreting this regulation. It's just, I have to do this. And then I ended up back in the industry, and the last 5 years spent working in digital pharmacies at Amazon Pharmacy and Alto Pharmacy most recently, before coming to Capital RX as head of compliance.
Wonderful. And that's our topic today is digital pharmacy. To kind of just get started, we have a lot of compliance folks out there, but they might not know what that term means. I'm not sure I fully understand it. What is digital pharmacy? How does it differ from telepharmacy, internet or online, kind of those different phrases and words?
Yes, well, it's a good question because even myself, I was like, oh, don't say that we're a digital pharmacy. That means online pharmacy, and that has bad connotations. And so, because when online pharmacies first started, there really weren't any requirements, there weren't accreditations, and so you started seeing nefarious actors trying to take advantage of this online pharmacy concept.
Right.
But as we all know, time has evolved and NABP has accreditations specifically for digital pharmacy. And so now the way you can think of it is online means any pharmacy that might have a website or a digital platform.
Okay.
But telepharmacy is a completely different beast in that it's usually reserved for a pharmacy that doesn't have a pharmacist on site. And
Gotcha.
so many states started licensing telepharmacy for rural areas where you might have a pharmacy desert. People need access to their medications, but it's difficult to find a pharmacist that will work in that location. And so telepharmacy developed. Digital pharmacy is kind of a combination. Well, it's online pharmacy, but tech forward. And so you might see more machinery, might see more automation,
Okay.
a little more outside the box thinking on what pharmacy can do.
Great. And so would you say that in digital pharmacy, a patient is interacting with the technology, or is it providers are interacting, or is it companies or insurance companies, or all of the above?
It really could be all of the above, especially looking at it from a patient's perspective. Digital pharmacy is trying to ease how the patient is able to access their medications, trying to get it to them in a faster manner, mostly through delivery services. Could be
Okay.
same day, next day, or even across all 50 state lines.
Okay, interesting. So how does the for the prescription, is that then submitted by the patient, or is it submitted by the provider, or how does that work?
Can be submitted by the patient. There is still some snail mail going on, but usually now it's through electronic prescription, so e-prescribing.
Gotcha. Okay, really interesting. Well, that I think helps us kind of understand the space we're going to be talking about a little bit and your expertise. So, let's jump in a little bit to the regulatory challenges. If you could share a little bit about the landscape of this, and how can these digital pharmacies stay ahead of these changing rules? And I'm sure they're changing quickly, right?
They are ever evolving for sure. And as one state creates a rule, another state tends to create one that is almost contradictory. And so it does start to present challenges when you start thinking across all 50 state lines.
Mm-hmm.
For example, when mail orders started happening, mail order pharmacies, and those may have even been designed around from the PBM perspective for
Okay.
their own members. They had to get state licenses where they were required. Well, not every state required a non-resident license, but then once one domino falls, they start
Yes.
going and they start realizing, oh, we should probably do this as well, because how else are we going to hold this pharmacy accountable should something go wrong, or you need to file a complaint or an investigation needs to happen if they don't have a license in our state. So now all 50 states, well, 49, I think, I don't think Massachusetts yet has created a non-resident pharmacy requirement. But there are 50 state licenses, because I think DC has their own, that a mail order pharmacy or digital pharmacy, if they're mailing across 50 states, would have to have. Now, many states started requiring pharmacists to also have a license in that state. So if you reside in, let's say, Arizona, as a pharmacy that is shipping to all 50 states, that's non-resident state might say, oh, you need to have a pharmacist on staff. It doesn't necessarily have to be the pharmacist in charge, but you have to have a pharmacist on staff that has a license in our state who is saying, yes, I attest that if something goes wrong, I take responsibility.
Wow.
It's all well and good when it's only a handful. I started with 17 state licenses. I went up to 23 state licenses, but as more and more states begin requiring that, what is a pharmacy to do? Now you have to have either 50 pharmacists with one state license in each. You have to
Right.
have a pharmacist in charge that has 50 state licenses, and that's a lot to handle, trust me.
Right.
And then you can't just have one person that has all those state licenses, because what if they leave?
That's right.
You have to have it deep, right? And so
Right.
it's becoming almost unwieldy.
Yeah, I can only imagine that. So, and the pharmacist then is doing. You mentioned if something goes wrong, they're responsible. So what is the pharmacist overseeing? What are they doing? Kind of behind the scenes or whatever.
Well, typically, and speaking from experience, it is not the pharmacist themselves that
Okay.
is overseen, right? Becomes the business's responsibility to ensure that the business practice adheres to those 50 state regulations. Also very unwieldy, because
Yes.
again, one might say you can do this, another says no, you can't do this. So you either have to tailor your operations to where the shipment is going,
Okay.
and that seems unreasonable, or what I have seen is that you pick the lowest common denominator.
Yeah.
So you have 50 state regulations, what's the most strict?
Exactly. Well, and that's kind of similar to what a lot of us do. I've spent a lot of time with healthcare providers in the billing scenario,
Mm-hmm.
where you have commercial payers and they have their requirements. You have Medicare and their requirements, maybe Medicaid, and you just pick who's the most strict, because we can't keep track, and it's not possible to like to say, well, let's find out who the payers are, and then let's try to meet their requirements. Let's pick the most strict so that
Yep.
we're safe with everybody.
Yep. I mean, even when it became a requirement to counsel patients, which it's hard to believe that that was never a requirement. But I
Right.
remember when I was in pharmacy school and CMS passed a regulation that says, pharmacists must counsel patients on the first fill. Well, no state boards of pharmacy had that requirement at the time, but what are you going to do? It's like, oh, I see this is a Medicare patient. I will counsel you, but oh, no, your insurance is commercial. I'm not going to counsel you. No, boards of pharmacy then realized we need to create a regulation around this as well.
Interesting. This is really interesting discussion. We're going to take a quick break, and then we're going to come back and talk some more about regulatory challenges, reimbursement, and those sorts of things with digital pharmacy.
Compliance is complex, which is why you should visit Healthicity's Resource Center. It features updates on the OIG's new General Compliance Program guidance, CEU webinars, and more. Visit healthicity.com/resources today.
Welcome back from the break, everybody. We're talking with Heidi McKinnon about this interesting world of pharmacy, digital pharmacy, and the regulations and compliance. She has years of experience, both the clinical side as well as the compliance side. So we were talking a little bit about kind of staying ahead of those regulatory challenges. Is it a team of people who are reviewing regulations as they come out from states? Is it like, what, just operationally, how does somebody work with that?
So I believe there probably are companies that maybe help facilitate this. But if you're not large enough to be able to afford a third-party vendor to help facilitate, what I have seen is, yes, you have a team dedicated to it, and then you'd have to perform a manual review of all 50 states. Now, I'm going to put a little plug in here for Bula, because I do appreciate the way that they have set it up for pharmacies to create a 50-state kind of analysis, if you will, depending upon the regulation you're interested in. And it can become very helpful, especially when it comes to shared services. Digital pharmacies, from what I have seen, they're not just in one brick and mortar place. Right. So you might have your front end operations being performed either remotely or in a separate location than your actual dispensing operations. And so that is considered to be shared services because you are sharing this information, right, in different locations or across different states. Again, complications arise when one state allows shared services or has very definitive guidelines around shared services, but another state may have opposite. And so again, how do we navigate what is the risk? Is this a high risk? Is this a low risk? What if your provider is in one state, the patient is in another, and the pharmacy is in a third?
Interesting.
Which regulation are you supposed to follow for what part of the process?
Yeah, interesting. Yeah, that sounds a lot like maybe you tell me if this is a good parallel. With before COVID, there was telehealth, and people were licensed in certain states. But with COVID, a lot of things went forward so quickly with the opportunity to use telehealth that some of these kind of challenges, people were trying to find solutions of, let's just license people so that they're licensed in all, like nurses or physicians. Yeah. Whatever. So it sounds this story is sounding a little bit like that. Is that kind of analogy good, or?
Oh, yes. I would say it definitely parallels, and COVID almost allowed the opportunity, like you said, to push forward in a very quick manner that wouldn't necessarily have occurred had COVID not happened.
Exactly. We see that a lot in history in general. Like I come from a medical background, and a lot of medical advances in the science happened during war. when on the battlefield, when you're trying to do certain things, and it's like, look, this is an emergency, we've got to try something, and and so sometimes, not that any of us want these things to happen, but history has shown that these types of things push forward certain technologies or processes, and then you can see some of the benefits. So with that in mind, did digital pharmacy see a big push in COVID, or is it more of a steady
For
increase?
sure. No. I had just started with Amazon Pharmacy right before COVID hit. And so it was, it was good, I think, because the framework was already there for digital pharmacies to be able to step in and assist during that time where people definitely want to go stand in lines at their local retail, brick and mortar. And the challenges, I think, are boards of pharmacy actually being able to keep up with the technology and the
Right,
advancements, right, that have been happening before COVID. But then again, COVID pushed on this little tidal wave.
right.
And I just, I was there. I
Yeah,
saw how challenging it is to have any kind of regulation even edited, even changed, right, to get it through legislature. And I can understand the challenges that they're in, but they also need to understand the technology as it's happening and
right,
think about the future when they're
right.
making these rules and regulations.
Yeah, they always, from a very high level, and having been in compliance for 25 years, it seems like those always lag behind the technical advances, either in operations or in science. There's always kind of this lag. Um,
Sure.
Unfortunately. But so, we were talking about state laws. It sounds like a lot of what pharmacies are working with are the state laws, because a lot of that is regulated at the state level. Are there federal laws as well? Would you say that much more of the challenge is on the state side, or are there federal challenges? Or
Oh, there's definitely federal challenges, for sure. One, in particular, the DEA,
Mhm.
their rules and regulations move even slower than state boards of pharmacy.
I could see that.
And there's still this concept that a pharmacy is a brick and mortar. And so you're trying to implement this framework in a space where it doesn't really work anymore. For example, just trying to identify whether or not the patient should be considered, or the prescriber even should be considered, a red flag. Well, one of those attributes is, well, how far away is the patient from the pharmacy? How far away is the provider from the pharmacy? Well, if you're dispensing across all 50 states, that can't really apply. And holding a digital pharmacy accountable to the same standard as a walk-in retail no longer seems applicable. And
Mhm.
so, as a digital pharmacy, how do you navigate risk, or how do you identify red flags? What does it look like?
Yeah.
Those are another federal challenge.
Yeah, so interesting. Let's shift a little bit to talk about reimbursement, if that's okay. So you've talked about that digital pharmacies may be located in a different state than the patient. So there's costs, right, associated with shipping, packaging, all this. How does reimbursement work in your world?
Yeah, that is a really good question, because if you're not a cash only pharmacy, you are beholden to
Right,
what your reimbursement is, right, from the PBMs. And obviously, if you want to grow your business, you're going to accept insurance, for those. Most of us have insurance
right.
in the US. And so, but traditionally, PBMs will look at how you are licensed. So if you are licensed as a retail pharmacy, they will reimburse you at a retail level. If you're licensed as a mail order pharmacy, they're going to reimburse you just like if you were long-term care, if you were a hospital.
Okay.
And so even after speaking with NABP about this, NABP is like, we don't create a license based on what a pharmacy is going to get reimbursed from the PBM. Like
Right.
we create a license based on the need. Is there a need for this new license? And so then it becomes, go backwards. Okay, now it's between the pharmacy and the PBM. But
Uh-huh.
PBMs traditionally have not identified digital pharmacy as a platform. Even in the NCPDP, which you need to submit the claim identifying yourself as either retail or mail order or long-term care or hospital, NCPDP doesn't have a field yet for digital pharmacy. Digital pharmacy is this new concept that's somewhere in between retail and mail order.
Wow. Yeah, that was what I was going to ask you. Is it sounds like there's two license types, retail and mail order. Is that correct, or are there other license types?
Well, there's other license types, but not for what they're doing.
Okay.
They're not a long-term care pharmacy. They're not a
I see.
hospital. So
Yes.
retail makes sense because you're going to get the best reimbursement because it's 30-day, it's acute, it's right now, the patient's walking up and needs it immediately. Mail order is typically 90 days. You could have more technology. You're not going to get reimbursed quite as much because the idea is you don't need as much labor to address those acute care needs. What happens when you allow walk-in, when
Right.
you deliver same day, and you
Uh,
mail across 50 states? Well, you're not getting reimbursed for your packaging or your shipping. And
yeah.
it creates this never-ending struggle, really, on how to maximize your reimbursements without there being a set platform for it.
So from a so that's really interesting. So from a from the perspective of trying to change that, is that something that state legislatures have to change? You mentioned, I think, the licensing body, but I might not have caught the acronym. So who changes that, and how do people push for that change?
So NABP is the National Association of Boards of Pharmacy,
Okay.
and they help boards of pharmacy write their rules. They have blueprints for rules and regulations that boards of pharmacy can lean into. But I kind of almost agree with them because boards of pharmacy are there to maintain the compliance,
Right.
not to talk about your reimbursement with
Gotcha.
the PBM. It's just that PBMs have leaned on, oh, well, you can't say you're doing this because you're licensed as this.
Okay.
But again, PBMs also say, well, if you're a retail pharmacy, you can't ship more than 51% of your prescriptions, or we're going to call you a mail order pharmacy, regardless of what your license is. So PBMs really hold the ownership to be able to think outside the box and say, okay, we see what you're doing as a practice, as a business. We do believe our clients and the members would benefit from this type of pharmacy, and what this pharmacy is offering. Let's talk.
Yeah, it sounds a lot like it really sounds like the patient experience and what the norm becomes is really going to push it, right?
Yes.
So it's very similar to when only physicians can prescribe, and then now we got nurse practitioners and PAs, and in some states pharmacists can prescribe for certain drugs and for certain
Yep.
scenarios. And so it seems like that's because that's what the people want. That's what the people need, right? That maybe the
Yeah.
physician do all this. We need other people involved. So is that accurate? It sounds very similar to that story.
Yes, I think it is accurate. And um, you know, if a digital pharmacy started and they just couldn't sell the product, they just didn't have any patients that were buying into it, it'd be a
Mhm.
non-issue. But that's not the case. And
Exactly.
more patients are seeing the virtue of it. I can just go online or I can download this app and I can tell my physician I'd like my prescriptions sent there.
Yep.
There is a need for it. There is a demand for it. And so I do think it's worth discussing and talking about to
Yeah.
get appropriate reimbursement.
Yeah. It sounds, again, going back to the telehealth story, it's like our lives are becoming more and more digital and things on the phone. It's like, if I can pay my bills and I can go to school, online, I want to be able to see my doctor online. I want to be able to receive my medications digitally, this digital process. And so I can totally see that. Well, Heidi, this has been really fascinating. We're kind of coming to the end of our time. Do you have any last minute thoughts or comments? People in compliance, I don't know, if I'm a compliance officer and I'm not an expert like you, but I'm starting to get involved in this space, where do you go? Resources, anything like that you might want to share before we go?
Yeah, it's the best thing I ever did was attend a healthcare compliance association meeting, because coming up through the ranks, if you will, in pharmacy, and even being a board of pharmacy investigator and inspector, I still didn't fully understand the Office of the Inspector General's 7 elements of compliance.
Sure.
And that to me was very eye-opening, and really opened up the opportunities once I got my CHC to delve into different aspects of healthcare compliance.
Yeah. Very good. I would agree. I think there's lots of value there, and kind of connecting with other people in your situation, right? Making
For sure.
friends, colleagues that you can bounce ideas off of. So, well, Heidi, thank you so much for your time and your willingness to share.
Thank you for having me. I appreciate it.
Yes, and thank you to all of our listeners for listening to another episode of Compliance Conversations. We hope to see you back again. We always do request that if you have topics or speakers that you think would make good material for the podcast, please share with us. Until next time, everyone, take care.